And let's see, Facebook, share your timeline. Oops, public. Okay, are we ready? I just want to make sure
Let,
Lightout's ready.
let me just share your Facebook Live.
Okay, let me go live. Give me a second. I just want to make sure. I go live now. Okay, we should be able to see it now. Let me know when it starts.
Okay. It still hasn't started.
Okay, I got a message as being live streamed. So as we begin this conversation, yeah, we are live on Facebook. Thank you for being here. We are live on Facebook. We're taking this conversation that we started a couple of weeks ago and we met last week to take it a little further, a little deeper. And as we were preparing for this, Dr. D and I were discussing really how language is important and empowerment. And this is what this conversation is going to be about. So thank you for being here. My name is Jackie Solomon. I am founder and executive director of Seeds to Inspire Foundation. We're a social justice education nonprofit here in Phoenix, Arizona. And that came of my journey of being able to restore my health through lifestyle medicine and making behavioral shifts that were so profound and reversed all my chronic diseases. And I truly believe saved my life. And this is the reason why I do this. I come to you from a patient perspective and I bridge kind of like that gap between what's happening in the medical model, the medical industry, healthcare system, and with regard to what we're truly experiencing, people that look like me, that grew up like me, that ate like me, that grew up in cultures of assimilation like me, how that stress affected our health and what we can do about it. So I've invited my dear friend and my colleague, Dr. Davis, into this conversation to bring her expertise. She is co-creator with me on this series, and we hope to continue this conversation. Dr. Davis is a quadruple board certified primary care internist and preventionist with an interest in working at the intersection of prevention, lifestyle medicine, public health, and health equity. She's committed to helping her patients and her community live healthy and dignified lives through prevention and effective treatment of preventable chronic diseases. She's also an artist and seeks to use her creativity to develop innovative public health solutions to make prevention the priority and to make it popular. And this is why we're so happy to have this conversation with you all, stakeholders, the people that are committed, that are already have this awareness and really want to know what to do with this awareness and how to take it forward. So thank you so much, Dr. D, for being here. Do you have any opening words before we start right into the questions?
It's just my pleasure to chat with you about these things as always, because I know your heart is in helping people heal and experience life in the best way that they can, which is my passion as well. And so, we're on the same page in that regard to just wanting people to experience life as they should.
Well, thank you again for making the time. Thank you all for making the time to be in this conversation. Thank you, Dr. D, for making time for this. So
Thank
let's
you.
just jump right in. We have discussed health within the healthcare system. And so many of us experience, months now. We discussed this the other day, how people went from waiting weeks to go to see their primary care. Now it's months. And now we have to see a specialist. Now it's even longer. So what is going on with the current healthcare system? Is it designed to make us well?
Designed to make us well. I think if we take it back to how the system developed in the first place, it really developed out of a treatment model. So that is the basis of how things operate, even in the way that we pay for services, which is a huge driver to how practice is delivered. It is the payment models, actually. And we have these conversations all the time in American College of Lifestyle Medicine, because our goal is, how do we allow lifestyle medicine to be accessed by every patient? And because we know that what gets reimbursed is what is delivered, we're like, okay, we gotta figure out how to have lifestyle medicine reimbursed so people can have access to it. But the reality is that our payment model is what we call fee for service, which means that we pay a fee for a service. And so that pushes us into a quantity type of system where we just do more things without I would say, a holistic regard to, is it improving the person's health versus a quality focused type of, approach, which is, how are these things that we're doing actually helping people? And so because the basis of our paradigm, our thought process is actually, let's do things, it pushes us to have more to do. So the more you can do, typically that's going to be finding problems to fix. So the more problems, the more you can do. And so it leads us into essentially waiting for things to happen. And now we have all of these problems. So now we have all these methods to fix them. But if we look at it from the model that we like to operate from, which is prevention, because there's power, and I always tell patients that, I said, there's power in prevention. That is something that we haven't discussed, that people haven't really understood, that they have access to power and they can then become empowered to take control of their health through prevention. It's an amazing thing when you could shift in that way. And here's the reason that I even tell my patients this is exactly what I say to them in a clinic visit, where we're talking about why I practice medicine the way that I do. I tell them that a third of heart attacks and strokes result in sudden death. So 33% of patients actually don't get a second chance to kind of turn things around. So, we waited for the problem to develop, but the problem for them doesn't have a second chance. The problem is sudden death. And so I think that is harrowing enough. Those are numbers that are clear enough that we don't really want to play with those type of numbers in that way. We want to get in front of that and be able to have that power to prevent that type of situation from happening in the first place.
So this is going to lead me to kind of like a little bit of sharing my story, because I think it's important for people to see how lifestyle medicine and my chronic diseases, where that intersection happened, and why I am a food justice and an environmental justice and a health equity advocate. Why is this so important to me? I almost lost my life on 2 separate occasions, and our family suffered a tremendous tragedy that created so much trauma and stress in our bodies. And so I started to learn how much stress, that chronic stress, affects our health. And so now with my private practice, Angel in the Stone, what I do is I specialize in helping people understand their health and the implication on their health from that living under that chronic stress, that culture of convenience, right? We're raising cultures of assimilation in many institutions, and a lot of that is under our awareness. So we bring awareness to it, and then we make behavioral shifts. But that's not easy, which is why I found lifestyle medicine. Why is it that someone like me, that grew up, attending public schools and living in the projects, and people like me, why is it that we kind of don't know about lifestyle medicine? Why don't we know about prevention? Why is it that I had to go through such tragedy that could have affected and traumatized my entire family? Why is it that I had to learn this on my own, find this information, and then navigate my way through this? Is our healthcare system, is it broken? Is it obsolete?
I think that our culture prioritizes certain things, and a big part of our culture is it's profit driven in its nature, and that's just a fact. That's not any kind of um quacky type of comment. It's really what it is. We see it all across the board. We know the US is a capitalistic type of model in terms of a country. So that pushes us into a lot of things are through market, whatever is popular, like any market, a lot of success can be driven to that, or profit can be made from that thing. So we find that that's in a lot of aspects of our society and our culture in itself. There's a lot of transactional things that happen where money is kind of the key transaction. But as a result, even with our healthcare system, there's a lot of profit in that and how it operates. And because of that, it really drives a lot of how things move, because it's a business model. And it's also very interesting because there's so many layers of it. For example, a lot of hospital systems are not necessarily led by clinicians. It's led by someone with a business type of background. So to be able to allow the business to be successful. And because of that, it's very easy to have a disconnect with the essence of medicine, which is to heal people, to guide them, to equip them with the tools that they need to be healthy. And if you're not really in tune with what that looks like at a granular level, at a interaction level with a patient, you can kind of miss the boat. And that's what we see happening right now. We've missed the boat in our focus on what patients actually want. So this is even a conversation I have with patients all the time. And, when I talk to them about, again, my focus on medicine, a lot of comments are, man, I'm so glad I found a doctor who's not just pushing medicines on me and actually wants to help me to get healthy. A doctor that's really concerned about my overall health and my longevity and my aging, and wants me to be able to get into the right habits that I've wanted to get into, but I haven't really known how to do it. Versus just pushing a pill. Before I even said anything, you already prescribed something to me. And so I think having that understanding of what patients desire, and how we can support them, and having that be the forefront of how we provide care versus what's going to allow us to be profitable as a business, then we can be in line, be in alignment with what is truly important for people.
Thank you. That so beautifully leads into my next question. In your opinion, have people lost faith in the healthcare system? Have people just completely lost their trust in healthcare itself? And you started to describe what the model of healthcare that you provide for your patients. If people have lost faith, what should healthcare be providing to people? What should healthcare actually look like?
So many thoughts on that. I think in some sense, the answer is yes, because you see the evidence of that, the symptoms of that. And we talk about how the healthcare system is also suffering from chronic disease, just as the US population itself is also burdened with chronic disease, more so than other countries in its peer group. And we see that with the frustrations that people have with the way the system is running. I can't get in with a doctor quickly. It takes, and even where I am working, we're in a smaller city compared to Atlanta that's growing rapidly. And so the healthcare services are catching up, are running behind that growth, and we're not meeting it yet. There's so much need. There's so many patients that need to be cared for, and we only have so many people. So we're backlogged with how often we could see patients. New patients are like, oh my gosh, I made this appointment months ago, and now I'm just getting to see you. So we see it in the frustrations with those issues. We see it with time. Patients are sharing what's going on with their health, and you need time to really get into the details to be able to help somebody effectively, to know what kind of support they need. And 20 minutes is not a lot of time, especially when there's more than one issue that someone wants to discuss. And especially if you're trying to really help people build healthy habits, it's not enough time at all. And so patients talk about not having enough time with the doctor. They're in and out. But then on the other end, the doctor is also frustrated. So it's not just patients, but providers as well. So if the providers are frustrated and they want to deliver a certain type of care that supports patients' health, and patients are frustrated, they want to receive a type of care that doctors want to provide, something in the middle is not allowing that to happen if the doctor and the patient are actually on the same page about what they want to do. So we see that with medications and the prior authorization issues, where people are actually having delays in care that cost their life. There's some cases with prior auths being denying medications. So there are all of these little symptoms, but multiple symptoms that tell us that the system is not operating in a way where the health is being prioritized, the health of the patients. And they're not just the acute health, like you're having a heart attack, let's get you. It works perfectly for that, but the overall long-term health, which impacts the daily experience of people, that I feel good, I'm healthy, I'm living a good life, I'm getting the most out of my life, that is compromised. So yes, we have a system that is not operating in a way that is supporting patients as they would like to be supported with their health. And I think people have lost faith in its ability to deliver the type of care they need. And where I do think we've veered off track with what we need to be providing to patients. Because think about it, healthcare in the name itself, we should be caring for health. How are we caring for health if we're not investing in prevention as a key foundational aspect of how we deliver care?
You know, I always found it fascinating when there is like a specialty of preventive medicine. When to me, isn't that the default? You know, like that, it's these things that are kind of like right in your face and you question them and you're like, for instance, you have an MPH. Like, how does that all come together in this topic? And then I want to kind of lead into those topics. Then, if the healthcare system itself is suffering from a chronic disease and it can't be there for us, there are some areas in health that are really, really not getting enough information and not getting enough attention. I kind of want to have your ideas on what those areas look like.
Um, so you talked about the MPH and how that factors in. So me being able to do preventive medicine residency was important because it gave me the understanding of how we are as humans, that we exist in a context. And so what's happening at the individual level is not isolated because as humans, our nature is not like that. We actually operate in community. That is a part of the human experience to be in a community, whether that be your family, or we widen it out to a neighborhood, or we widen it out to a city, or we widen it out to a country, the globe. That's just how it is. So we could do it on the smaller level, right? Nuclear family, or individual family, or we take it out. That's how we are. So we are always going to be connected, and we're always going to be influenced by what's around us. People have that phrase that they share, which is, tell me who your friends are and I tell you who you are. That is basically highlighting the impact of what's around you, the influences around you, and that as a person, you actually have to be mindful about what you put around you because it influences you. So I think our culture is a big part of how we live, and that is a big part of what influences our health. And the way that our culture is set up at this point, it's kind of like everything's kind of off doing its own thing. You know, everyone's focused on what they're doing. We're trying to have good business over here with the food. We're trying to have good business over here with work. And everything's like, we're just focused on everybody being successful in the business aspect. And it doesn't really think about the health aspect of people, you know, together generationally, you know, so the focus is just so off balanced. That we have to come back. And so having that MPH has given me such an insight into how to think about impacting health at the population level and understanding the type of impacts and factors that affect people, and that individual choices are not, when people are making choices that don't seem in line with what they want for themselves, you have to step back and look at the context. It can be really easy to point fingers and why aren't you doing what you need to do? But again, that's not factual because people live in a context. I hope
Thank
I
you for that.
answered that
Yes, you did.
question.
You did, because that again leads me into kind of like this next part of the conversation I want to make sure we get to is there's these two areas that I feel are getting so much support, but I don't feel are really connected to this conversation. And that is really understanding how lifestyle medicine in particular, prevention, how does that affect mental health and men's health? These are the two areas where I feel like I'm in a lot of these conversations. You know, people that know me know that I work in a lot of organizations. And then I work with organizations, you know, grassroots organizations, people like me that are just taking our experiences and either have that aha moment and like, why didn't I know this? Like now that I know this, I can't not know this. I have to do something. And those of us that came from like, this saved my life. I have to help people. People have to know that this can happen.
Right.
So what is it about men's health and mental health that is not as part of this general conversation around health as other subjects are And we can go into that. And this is another conversation. We'll probably have another one. But if you can help us understand specifically with your knowledge and your practice, what is that about?
So that's why I am so grateful to have found American College of Lifestyle Medicine and to have really matured as a clinician through this community, of professionals who are passionate individuals who are driven to really help patients find their health again, because that is the priority. Your life is a priority, so your health also has to be a priority. And when you think about lifestyle medicine, that is the perfect framework to practice medicine, because you are essentially ensuring that the foundations of health are secure so that the outcome of that can be true health. Because health, like anything else, has these types of building blocks. Like anything that that is going to be strong and withstand stressors. We build homes, we don't build it with a poor foundation. We make sure that foundation is intact. Your health is the same way. So there's a connectedness with all of these pillars. That's what we found. These key parts that we focus on, the paradigms that we look through, is understanding that these are the key. We distill health down to the smallest reducible thing, and we find that these 6 elements are critical: nutrition, physical activity, stress management, social connection, which is really just love, good sleep, and avoiding. I actually think about it as being in tune, being aware of what's going on internally, because then when you can dodge and avoid the things that could be damaging to you when you're in tune with what's going on inside. And so when it comes to mental health, I think that's where we have some of those symptoms pop up again, that the system in it also suffering from a chronic disease where it's not taking care of itself. The healthcare system's not taking care of itself. It's overworked, it's overburdened, it's not listening to itself and hearing the feedback of patients that I really want more care that is focusing on helping me improve my health and prevent disease. It's not working and working with others, working together. We see that we're not understanding that mind and body are connected. It always has been that way. We're now having that become more a part of our conversations, just population-wise and just the public discourse. But mind and body are connected, and stress, like you talked about, chronic stress is where we see the impact of your mind on your body. That is the evidence of the connection between the mind and the body, the effects of chronic stress. And as a young practicing physician, what I learned in medical school, it's blown my mind to see how the interconnectedness of the body is being highlighted with the type of dysfunction that I see many individuals experiencing as a result of chronic stress that they experience. And that's not just chronic stress from daily stress that you're experiencing, but it's past stress that's put an imprint on your immune system and now basically shifted you in a type of emergency mode 24/7. So your reactivity is a lot faster, a lot higher, a lot more constant. And your body is not made to be in emergency mode 24/7. It's there for emergencies. If we were calling 911 every 2 seconds, they're not coming back after a while. You're like, we're using too many resources. Every time so your body's in that same mode, and it's using all these resources for this emergency, fight or flight, that's being activated by stress or has already been activated from stressful experiences in the past and hasn't been able to turn off. So I think when we understand the harmonious nature of the body, prevention by building the building blocks very strong in our health and ensuring that those are in place, and making the connections between those building blocks, we can actually make progress in mental health, which we've seen how that's a struggle for many people these days, and the amount of stress that we experience have increased significantly over the past several years of the pandemic in particular. Now, to finish with the mental health piece, I think that's an area where that's a cultural influence and disconnectedness to body and awareness of oneself, because with mental health, I think there's a lot that is basically conditioned with men in regards to their health. We know I would say generally that men go to the doctor less than women, just as a kind of statistic off the bat. I'm sure there are numbers to really support that, but just from what we hear in the public discourse, men typically don't go to the doctor as often. I see it in my practice, so I can see that those numbers come to real life where I'm like, wow, the patients that tend to, oh, I haven't seen the doctor in 20 years, 15 years, tend to be more my male patients. And so there's a disconnectedness to that being linked into health. Culturally, it's like, I don't need, there's so many things about that, but it tends to be, I'm strong, I'm good on my own, I don't feel any ill, I don't have any symptoms right now, I should be fine. And then when it comes to mental health for men, I think that's an area that is really, we are seeing the effects of that being unaddressed, where for men, there's a lot going on mentally, but because the culture does not allow men to have, I would say, a good relationship internally with their emotions, where they can express that freely without feeling, the constraints of how society has said men should operate, then you're having dysfunction with how you are managing your stress and your emotions. And if you're not able to do that in a healthy way, we know that that's where the chronic stress begins to show its ugly head.
So again, what I'm seeing is that we're looking at so many different manifestations of the implications that are very kind of few. It's lack of access to whole plant foods, which we'll get into next, lack of access, and I would even venture to say an intentional absence of this information and education we don't have access to. So we're seeing the consequences in our bodies in so many different ways. And again, I'll bring it back to like why I do the coaching the way I do is because there's a keen understanding that ancestral inheritances affect intergenerationally and then affect interpersonally. And I didn't realize how much of that stress, that chronic stress that goes under our awareness, the people that we love, the people that say that they love us, how much the stress in those relationships affect our health. And I think that that's a piece that's going way under the radar when it comes to mental health, is really understanding how we manage these relationships and really understanding that that is an intense chronic stress that we live with. And how I was able to incorporate that into my healing was kind of like when you understand that what is happening in your life, that's a liberation, that's an empowerment. And we talk so much about that piece of empowerment is awareness and then learning and then the application of that. So how do we, right? We always talk about that, like you and I was like, we empower people because we have faith in humanity that everybody wants to be their best. When you provide the information and you share resources and tools, everybody wants to thrive. Everybody wants to be that dancing elder, at their great-grandchildren's wedding. Everybody wants to walk their great-grandchild down the aisle and watch their great-great-grandchildren be born. Like that's my dream. And I get to live that because I had access and I was able to learn and apply this. So where can people start when they're just sitting in it, just, watching this on our YouTube channel or on Facebook Live later? Where do we take this information? How do we empower people in this moment? And help us understand specifically if we start with food, because that's again, with the organization with Seeds, we really, really focus on food as medicine. Can you tell us what exactly, specifically with the pillars, what is food as medicine? And then how does that apply to all of these diseases? Like we said, we're seeing all of these manifestations, but why is it that food as medicine, lifestyle medicine really does treat or help us heal from all of these different manifestations of how stress affects us? And how does that empower us?
So I think even before we get to the food portion of it, I think the mental part, coming back to that, is having a why about your health, having a why about why your health is important to you, why living in a way that supports you living the best is important to you. And I think that that's where I find motivation is triggered really powerfully for people, because many times they haven't linked into that power source of why this is important, that internal motivation. It's a lot of external recommendations and suggestions and influences from outside culture. Yeah, you got to be healthy, you got to exercise, you should be eating properly, all these things that you should, and this is what you need to be doing. But to get that to come from someone internally is the goal, because then you can be self-sufficient with that desire to live in that way that's going to support you best. And so I think helping people to do a little bit of digging, a little bit of deep digging to get down to what matters to me, what about my family? How do I think about being here for my family? And I find that when people even struggle to think about what is important for them, once you bring their family into the mix, my grandchildren, my children, all of a sudden it's like, okay, all right, paying attention. And it's so predictable. So that's again back to that connection, the relationships that we value. And then coming to food as medicine, food is the body. Food is the body. And that's what I think we've lost that understanding of. We are nature, and when we take nature in, we're fine. When we eat food in its natural form, we're good. When we're eating food that has been changed because it's been processed in some way away from its natural form, now it does things in our body that it wasn't designed to do, or it does things in our body that real food does not do. So here's an example. I actually talk about this with my patients in clinic, and I say, can you eat 3 sweet potatoes baked? And they're like, no, I'd be too full. The first one, I might not even get through that. And then I say, okay, well, can you eat, how many sweet potato fries can you eat? Or how many sweet potato chips can you eat? And now they're like, I could probably take care of a good bag of sweet potato chips. And you might have more than 2 sweet potatoes in that bag. So the processing has turned that food into something different, because what the food is supposed to be doing is communicating signals to your brain to say, I'm full, I'm nourished, I'm good. Let me go ahead and take care of this food. But when you're taking in processed foods, they've been changed. So no, they're no longer communicating those same signals to your stomach to go to your brain to say, hey, you've had enough. And that is how processed food works. That's why we gain weight eating a lot of processed foods, because it does different things to our bodies. But food is the body. And so at the cellular level, food contains cellular pieces, machinery, nuts and bolts, parts, all the things that go into allowing your cells to function properly. And I think I used this analogy the last conversation we had, but we would be hard pressed to be happy with a mechanic if they went in to fix our car and they went in and took about 12 things off the tires and then 20 things off the engine, and then they closed it up and they're like, your keys back. And you're looking at them with like, they have 4 heads, because you're like, what? I know you're not gonna have me out on the road driving with this car. I'm fearful for my life. So in many ways, that's we're driving around with cars like that are missing many nuts and bolts. And then we are starting to see the smoke coming up, the noises banging with the symptoms that we feel in our body, the fatigue, the pains, the joint pains, the headaches, all these different things. So food as medicine is understanding that food is the body. And so what we eat can heal and what we eat can harm. And how do we shift ourselves to making sure that what we're eating is healing us?
So how do you start this conversation with your patients? They come in, they're ready, and usually, at least with clients that I have, it's usually a diagnosis that's their aha moment. It's like, okay, I didn't realize my numbers were that. I didn't realize now I have to go on medication and I'm resisting that. I want to do something natural. And I hear that a lot. Like, I know people are responding to their intuition. Like, I know I can do this. I know I can get healthy on my own. I know, and they're resisting that. And that's that thriving piece of us that are like, there's an innate wisdom inside of my body that's guiding me. I don't see it. I don't hear it. I can't identify it. So those people that are hearing this and something's resonating and saying, yeah, like when I first discovered whole plant nutrition, I was able to reverse all of my diseases. There was this it just felt right. It sounded right. So
Clicked.
when people, right, something clicks that like your body just knows, your body knows. And I think
Right.
also part of our healing is not only specifically that love piece. And I believe all trauma can be healed and all relationships can be healed when both people are committed to healing, and which is very healing for the body. And introducing the food that kind of gives our body that resilience to keep going. So where do we help people that are like, okay, this sounds right in my body. I want my intervention to be stronger. I want to be informed. I want to make calculated, informed decisions for me and my family. But this is the first time I'm hearing about this. Like, where do you help your patients like start?
So we start off with getting some metabolic blood work, going on just to see what the risks are, what the metabolic risks are. Do we have any prediabetes in the mix? Is the cholesterol elevated? What's going on with your blood pressure? What's going on with your weight? We don't use BMI as the only thing, but it's a kind of general screening. And for the most part, if we look at population-wise, high BMIs tend to be associated with excess body fat. And so I kind of check in with the patient to say, how do you feel about what we have here? How do we feel about this information? And I let them start to kind of share their thoughts about it. And I find that a lot of times I will hear my patients share already, yeah, I got to get this weight off, or, I know I'm not where I need to be with my health. And they already are thinking about these things. So I'm not coming in here to be like, you gotta, it's like they already told themselves that, so they got it. I know I'm here to provide the support and the encouragement that this is where you are, but hey, you have a lot of power right now because you're seeing the situation before it's gotten where it could be worse. So that's a plus. We've caught something in the beginning, and now we're gonna give you some tools, and you're just gonna start where you are with the tools. And I find that people are they're very empowered where when they know that I can do this, I am confident that I can do it because the plan that we've discussed is nothing that seems out of my range. And where do I want to see myself in terms of my health in the future? And I say, you deserve to have good health. You deserve to feel good. And that is what your life should be. You reaching your peak at 40 and then 50, 60, diabetes, hypertension, high blood pressure. Do you feel like that's normal? And they're like, no, that's a mess. And I'm like, tell me what you think about our current food culture. Like, yeah, I know we don't eat healthy in the US. And I'm like, okay. So you understand the dynamic of what's around you. So a lot of what I'm going to help you do is unlearning some of these, thoughts, beliefs, I should say, ways of living that have been really taught to you about how to move forward. Let's talk about the diet that we eat and what supports health, what versus what harms health. And I have a diagram on calorie density that I've kind of turned into a different type of conversation around just optimal health. And the way that I do it, it's been very helpful because I talk about home being where you're happy, your body's happy, and that's all of food in nature. And then we get into those higher calorie foods, and that's vacation. We don't live where we vacate. We go and we enjoy, we have a little fun from time to time, but home, you're happy. And that's a good place with healthful eating. So that's usually where I start with patients.
So for people that are like, okay, first of all, where can I find my own Dr. D? Like, or do you say, how do we start to advocate for ourselves now that we've learned this and we know we want to start and make these shifts? We want to get kind of like that baseline so we know where we're starting from. Do you recommend people self-advocate for themselves and go to their primary cares? Do you have them learn and educate, maybe find, because there's so many databases that have, clinicians that are trained in lifestyle medicine or food as medicine. So
Mhm.
where do you feel people start? But before you get there, I just had another question come to me. Why aren't more doctors knowledgeable about this? Why is this kind of feel like a new thing? Why is this not
Yeah.
common?
So that's exactly why ACLM, American College of Lifestyle Medicine, pretty much exists because they're answering the question of why is it that so many physicians are not understanding the significance with which how lifestyle impacts your health. It's not just we'll try that it didn't work. the reason that it didn't work for you to lose weight with changing your diet is that you didn't have the infrastructure to allow you to do that in a consistent way. And we also need to address what's going on in your mind as you're going through the health journey, because there's a lot of different cognitive distortions that happen when people are going through their health journeys and things that set them back, the failure, fear of failure, all these different things. There's so many levels to it. But having that type of understanding is really key. And the way that doctors are trained in medicine is really back to what we discussed at the beginning of this conversation. The paradigm through which we view medicine is on a foundation that is not sustainable because we're waiting for things to break. So we're gonna have a lot of broken stuff if we keep doing that. And it's just we're gonna be continuing to acquire broken things. If we think about it through a paradigm of let's protect, now we are putting energy in limiting, lowering, reducing what's broken. So instead of having all this pile of broken, man, I got a lot of stuff I gotta fix. This whole warehouse is full of broken stuff we gotta fix. Now it's like, wow, we have this system over here that protects this glass from falling. It puts this glass in a protected, alarm system. So much more or less to deal with on this end. And so the way that doctors are trained is not with that type of paradigm in mind. And it's not doctors' fault because patients have that reaction. And I feel it sometimes where they're like, why I can't? And I'm like, listen, I'm with you. I hate that I have to work 20 minutes per patient. Frustrates me. I hate it. I want to spend an hour with a patient if I could. But the system is designed in that way from the business model. And we then are kind of confined in this way that doesn't align with how to deliver health in a way that's going to have people really get to the place that they want. So yeah, I think there's just so many things. And we're in a place now where people are having these types of conversations. And so I'm so happy about this because we are a part of having these types of conversations that need to be had, so yeah. But let me say one thing. I will tell you that doctors want to do this because that's why we have so many of us who are getting boarded in lifestyle medicine, so many of you health professionals who want to be health coaches, all across the spectrum of health providers who want to be involved with helping patients get their health back. And there's like a movement to try to reclaim those skills to help people.
Thank you. Thank you for that. Because again, that beautifully leads into the next topic, which is like to me and for us, for the years that we've been working together, it really is at the core of this, that again, if lifestyle medicine isn't discussed broadly, the topic of health equity through lifestyle medicine is really something that's still, unfortunately, still fringe. And this is our passions where we intersect. Help us understand as a community the importance of focusing our energies on health equity, lifestyle medicine. How can we reestablish generational health, generational wealth through health? How do we get people healthy by focusing on that health equity piece? If you can help us understand your definition of that health equity piece and that lifestyle medicine and how that really brings us here to this conversation. Because again, I'm hearing these conversations with people, clients, people are suffering. We said last time we spoke, we are in a critical condition. Healthcare, our health, our communal health, it's critical. People are suffering and people are dying and people are afraid. How can this conversation, we meet people where they are. This is the reality. People are scared. They're getting these diagnoses. They want to be better. How do we turn this in and transmute it to like empowerment? How do we bring these pieces together to support community, to reestablish health by talking about health equity and lifestyle medicine?
There was something you said that came to me and I wanted to comment on it, but okay, but if it comes back to me, but in regards to the health equity piece, I think about it as we are creating a space for empowerment to be collective. We're creating a space for empowerment to be collective. And the community operates as an incubator for that. Because when we can link everybody up, right, power in numbers occurs in that type of dynamic. And that's why we talk so much about the community being activated and healing taking place in community, because when we can be able to activate that, now we are being able to get mass, we're getting power in numbers, and that can actually move the needle on societal issues. Because when more people are doing a certain thing, now everybody has to pay attention, because now it's becoming the conversation. And we talk about how that has played out in history, with the civil rights movement and people being activated, being empowered in themselves to take a stand for their right as a human. And we're seeing that type of thing happening now with people being activated in taking a stand for their health. That's what's happening now. I believe that that's what's happening now, because so many people are seeking health knowledge on their own. We have the internet, we have social media. So now we have access across the board, and people are coming into knowledge of how to improve their health on their own. Because I have patients who are like, I lost 60 pounds. I started doing my research and I started cutting this out and making those changes even before they see me. So we are having that empowerment, and now it's for us to intentionally drive energy and efforts into making those links stronger and to nurturing and building those communities stronger, so that people can access the power in healing together. Because not only do we have connection, with each other, we feel like, okay, it's okay, you're on my right, this guy's on my left, we're doing it together. But now we have access to resources and knowledge, which is compounded together, because now, as you always mention, you use this term, the collective wisdom that we have. You have wisdom from people because people are experts in themselves. And now you have wisdoms from many people who are experts in themselves. We can find the themes, we can find the similarities, the patterns, and that helps people to begin to create that path, right? That comes back to that intuition, that path that we know is the best, for human experience from a health standpoint. So I think power is in community, and that's actually where we need to be starting.
I love that you always are kind of bringing it back to like that centering, that community, that communal healing, because that's again where we talk about kind of like where those intersections happen, and that wisdom. We are really always looking at the same thing from different experiences, and we've been led to believe that we're doing different things and we're experiencing different things, when you really, really look at the core root issues of how are these injustices, where they start, where they're festering, the fire that still fuels all of these injustices. The root causes are really simply, we have been taken out of living basic human ways. That really is like, we as humans don't live naturally, and we're not in basics. And this is what our team talks about, Seeds to Inspire. And our chief medical officer, Dr. BC Ali, she's such a wise soul, and she's always reminding us, like, we need to go back to basics. Like, we need to really understand like what it is, what food is, how we feed ourselves, and to educate ourselves on how our bodies work. That's a lot to cover in 20 minutes with our current model. So we're in the crisis that we're in. We have this model, which is why you mentioned coaching. I think that coaching is coming to the rise, and why I love coaching. And so I just kind of wanted to bring your insight, as a physician, why do you value coaching? And then I can just share really quickly why I coach and why I love it so much.
So I remembered what I was going to comment on, and I'm going to come and answer the question or talk about the coaching. But I just wanted to basically make a statement that, lifestyle medicine, where people may describe it as something new or is a little on the fringe, that is a label that's being placed on that. Because if we're being honest, just like you said, we're actually just returning to where we used to be. So there's nothing new about it. It's that it's kind of been covered with all of these things. And so people are now finding their way back home, back to the basics. So lifestyle medicine is being discussed in a way that this is something new, and it is not. So I think that's just just highlighting the way that we can frame things, and how the way we view things and perspectives has a really important impact on how we receive the information. Because everyone's like, well, okay, plant-based vegan, everybody's getting new with the plant-based and the vegan. And it's like, humans are plant-based. It's always been that way. It really, really has. And it's not new. So we just kind of return home to that reality. And then, asking questions about the coaching. Coaching is facilitating someone's process of success. That's what it is. Like a coach does that. They coach people to a victory. They coach players to a championship. The goal is for you to be successful. So it's already positive at the baseline. And then it gets into the nitty-gritty of your daily life, because I can tell you all the things. I can give you wonderful data. I can show you the before and after transformations of the patients who I've worked with who've done great. Their A1C was 11, now it's 6.3 after 3 months of doing a plant-based diet. But how do you incorporate that in your personal experience is a question that people have. And that is where we find and identify the barriers that tend to create create barriers for people as they move forward. So I think that coaching helps to give people the tools to pivot and to work around those barriers so that they're going to be successful, because everything's going to have barriers and stumbling blocks. It's life. That's what we're dealing with, right? That's why we as humans have a stress response. We don't make the stress response. We have it. It's in us. So stress is something that we will experience. So that's in our body to protect us, but we begin to learn how to navigate these types of obstacles. And coaching is one of the most powerful ways that we can assist people in creating those toolboxes for themselves, those techniques, those strategies customized to their life that will allow them to have success with their health in the long run.
Thank you so much. And that's exactly why I love coaching, and specifically group coaching. There is nothing like when you're with someone and you see kind of them making the connections, and they can see and they find the success and they're like, do this? Now that I look at it that way, well, had I known, that's when you're like, okay, now we're starting. And that always drives me because I get to re-experience my own healing through helping other people. I get to revisit those times where I was like, I did this. I saved my life. My family benefits because I'm still here. The disease is reversed in their bodies, not just because everybody wants to be better, not because it was forced, it's not imposed anymore. And I just love that experience. And I love watching the community come together and educate one another and continue to evolve and learn from one another. So that's why I'm passionate about coaching and supporting physicians to help their patients reach those dreams and those goals that they have for themselves. And you touched on really something important. I want to go back a little bit. We have a few more minutes. It really is that getting back to basics and understanding that, especially, as Rosamund Mencken calls us, bodies of culture, those of us that, have a lot of our chronic diseases due to social determinants of health, due to imposed assimilation, due to that chronic stress of being in Black, Indigenous, and racialized bodies constantly. So how do we talk about lifestyle medicine again? Respectfully, it is medical specialty. People are working very hard to be board certified in that. But we really do realize that this is our natural way of always living, and it's opportunity for us to reconnect to our ancestral indigenous ways, learn, reconnect with how our ancestors lived, and we're connected with Earth. And you talked specifically about us humans being naturally plant-based. Can you touch a little bit more about that before we end?
I think that it's that awareness that I talk about, that last pillar that I think we don't pay enough attention to, the awareness, because that's where, if we think about the fact that as a population, 70% of the US population has excess weight that increases risk of chronic disease and early mortality. If we can see a factual statement of what the situation is with body fat right now. Is that people just choosing to do that? I would beg to differ. It's an awareness thing, awareness of their environment, awareness, because what has become common is the culture, but what's common is not always correct. And having that type of awareness to kind of realize like, wait, whoa, you know, fast food as a daily part of our eating pattern. Something is very wrong with that. You are getting no nutrition when you're eating those foods on a regular basis. But that's so normalized that people aren't even thinking about that when I eat this, not only is it lacking, but this is actually creating damage in my body. And that is the fact about fast food. We just have to, it is what it is. We are ingesting these foods on a regular basis, and that kind of awareness with what they actually do is not there because of the culture, you know, how we've been conditioned. So, you know, educated, all those different things. So I think awareness is a huge part of it. And I think that's a big part of what I like to focus on, or what I try to do with my patients, is to try to create discrepancy so they can kind of have a light bulb, say like, whoa, wait, hold on, let me kind of rethink this, because humans are going to be ambivalent to change. That's just a normal response in the beginning. But when their awareness shifts and they're like, huh, that's when the scratching of the, you know, that's when the power comes, because now they're seeing something in a different way. And we've been talking about health for, I mean, we always talk about health, and we're not seeing the type of impact and movement that we need to eat your fruits and veggies, exercise every day. Like, it's become such a constant, like a trope that people aren't, that doesn't mean anything. It doesn't do anything emotionally to somebody to get activated to say, no, my health matters because I gotta be here. And I want to live my life in a way that's going to be my best experience, not a way that I'm actually suffering and feeling impaired, and I don't feel good on a regular basis, and I'm at risk for developing conditions that I don't want to have in the future. Awareness. So I think awareness is the baseline, and that, you know, factors out into everything else.
Thank you. Thank you so much. My takeaways from this conversation is, yeah, our healthcare system is not only broken, it is seriously in critical condition due to its own internal chronic disease. It's very siloed. It has never been designed to center and prioritize actual health and prevention. And that model is quickly shifting. And there's physicians all over the globe that are really going back to the basics and learning about really how to understand how we can help and support patients to take back their health and empower them through lifestyle, through taking back that power and going back to basics. And I'm so grateful for this conversation. I'm grateful for you, Dr. D, for doing the work and being a leader in this. And so, do you want to introduce what we're talking about next week? We'll be back next week on the 24th, Dr. D.
I'm very excited. So whoever is here, you need to be here next week, because we're talking about what is health, right? That's the conversation. What is health? And when we think about health, then we have to step back and think of that first layer foundation, the strongest foundation of our health, which is food. So then what is food? And what amazes me is that we could talk about food, we could talk about sleep, all these different pillars, and we go from food and then it expands into so many different things in the conversation. I mean, there's so many angles we could have this discussion, but getting into just that basic, what is health and what is food? And why is it so difficult for us to really find the right information in our wild, wild web era? That's where we're living, in the wild, wild web. And how do we navigate that, you know, together? So I'm excited for it, and we really hope to see you guys there.
Thank you. Thank you, everyone who joined in, and anyone who's going to listen to this later. This will be on our Facebook, my Facebook page. It's also going to be on our Seeds to Inspire YouTube channel. We'll be uploading it then, and we'd love for you to join us. So always attach the link to register. We'd love to have you in the room and have interactive conversations. And in between, if anything has been inspiring to you, or you have questions and you have topics that you want us to go further into, please reach out to us at our website. You can go on Instagram, Facebook. Reach out to us. Let us know what you want this conversation to go deeper. And again, this conversation is with community. We're here to contribute what we've learned and our tools, but we want to collaborate with you all to help figure out how to make sure that everybody gets healthy. And we do this now. So if you have any questions, or you have topics you want us to cover, you have questions for Dr. D, please reach out to us. Thank you so much. And we'll see you next week, Wednesday, same time, 12 p.m. Pacific, 3 p.m. Eastern, Facebook Live, and here in the room. Thank you so much, Dr. D.
Thank you, Jackie. Take care.
Thank you so much.
Thank you.